I worked for hospice for the last 20 years of my career, nursing career. And this one thing that I'm going to tell you about, this one story, haunts me. I was working as the triage nurse. It's like in the ER. You take the incoming calls and you either solve the problem on the phone or you send a nurse out to visit. And this woman called in and she said, my husband is a hospice patient, and hospice only pays, I don't know whether you all know this or not, but it only pays for the drugs that are needed to control the symptoms at the end of life. If you're a cancer patient and you have coronary artery disease on top of it, hypertensive, whatever, we wouldn't pay for the antihypertensive. She said, we're out. Both my husband and I are hypertensive. Can you pay for his drug? And I managed to get permission. We have a outfit called Friends of Hospice that would pay for his medicine, but there was nothing I could do for her. And I'm thinking, the government the system would rather see her stroke or him stroke and die prematurely than pay for something that is preventive care. I don't know what happened to them. I know that we couldn't cover her meds. Did she stroke? What happened to her? There's something wrong with our system when we let treatable diseases go untreated because people don't have the insurance or the money. Death panels. You know, you heard a lot about death panels when people were trying to defeat the health care plan that's currently in effect. The true death panels are in the halls of Congress. A country is judged by the care it gives to its young and its old, the most vulnerable among us. I see two faces when I think of the old. Both have workers from the Medicaid waiver program. The Medicaid waiver program pays for care in a patient's home, supposedly to keep them out of a long-term care facility. The problem was both these patients were bedfast, and they only had workers from 9 to 5 and not on the weekends, just day shift. After that, they were alone, bedfast, unsafe, vulnerable. They were both supposedly mentally competent, and they choosing to stay in their own homes away from long-term care. They had no family that could help them. The one patient was eventually moved to the Hubbard House in Charleston, and she died there. I do not know what happened to the other. I only saw him one time. America, a land of the opportunity for all. America the beautiful. America the cruel.
Thank you, Ruth. Bobby, do you want to say a word?
I'm Bobby Hatfield. I'm a nurse, and I serve in the West Virginia House of Television. I have never seen anything in my life of the suffering of my patients. We see people coming in that have not had health care. We've seen women with breast cancer that have not had a mammogram. That is the right of every person in this nation to have health care. So I support the universal care. I support what's going in Congress. We need to be doing more because we see the patients every day. We see them out of work. We see them can't pay their rent. They're losing their houses. And the working class of the nation has been attacked. It is time that we are making a statement now. It is time to attack Wall Street. It is time to make them pay their fair taxes. I want to thank the nurses that are here. We have nurses that could not come because they're taking care of the sick. They're taking care of the elderly. They're taking care of the people there. But their spirits are with us. We have 23,000 nurses in the state of West Virginia, and we need to activate all of them. Call your congressman. Write to your delegates. Get involved. Some of the nurses can't be here because they are fear of intimidation. of their workplace. I've been there, but I don't have to be afraid anymore. So you can help us, and we need you. We need you to talk the talk. We need you to get out to your communities. We need you to write letters. We need you to get out and vote. Now is the time to turn America around so that the working people and the people on Main Street have an even chance. I tell these nurses, you know, you talk the talk, and those of us that can come out and not fear for our job will walk the walk. And I encourage you to get involved. Thank you.
Thank you. Are there others with stories to tell?
I don't know how much of a story I have. My name's Wayne Revich. I'm a proud union member. I'm a veteran, and I'm mad as hell. And I want to know why everybody else isn't mad as hell, because they should be. We live in what supposedly is the greatest country in the world. Yet, as the good doctor informed us a few minutes ago, our death or child mortality rate was ranked 41st. 41st. Cuba beats us. We don't have universal health care. Most of Europe, most of the industrial world has universal health care. The thing that's so maddening about all of our problems is that they're not so insurmountable. They keep pretending like we need bold new ideas. There's very simple solutions to our problems. Healthcare is single-payer healthcare. Medicare for all. Social Security. If we simply eliminated the cap on Social Security, the way it's set up now, after you make $106,000 a year, you no longer pay any Medicare or Social Security taxes. Eliminate that cap. Get fake Social Security taxes on every penny you own. Millionaires and billionaires don't pay the same taxes you do. If you could claim capital gains, your tax rate is only 15%. There are 25 hedge fund managers in this country. One person. 25 of them that average making over $1 billion a year. One person. The top guy made almost $5 billion. He paid 15% tax. That's, pardon my expression, bullshit. I mean, income is income. He should be paying 35% tax on his $5 billion. If we did this, we'd have enough money to take care of the people in this country. We could put people to work, and we could eliminate this deficit. Everything that happened over this raising the debt ceiling was manufactured. It's a joke. And we have to call our congressmen and our senators, Republican and Democrat alike, to start standing up for the American people, not the corporation. Thank you.
That was great, Wayne.
Thank you much. Anybody else that's got something to come up and talk about? This is democracy at work, right? We're up here telling it like it is.
These are retirees. They refuse to talk. They're Republicans. You can't say nothing, buddy. It's the Democrat ain't gonna walk behind.
I know you have a story because you told it during breakfast, so.
Hi, I'm Wanda Mendez. I work at Bickley Appalachian in the ER. I meet a lot of people every day coming in as a product of this politics problems we got around here and the healthcare issues. There are so many people coming in from every state, taking up, absorbing what we have here because they have no insurance. They think that we got free clinic and those kind of things. We need to stand up for these people, help them to retain their home and their dignity, give them back something that they can live with. Wall Street has taken away everything, and we're protecting the big corporates, but nothing is for our working people who's created this Wall Street in the beginning, gave us even reason to work. But our people, our jobs are going out of this country. Our percentile of the textile, I think Darlene talked to that. Their jobs back when I was in the 70s and growing up looking for jobs, they were plentiful. Now you can't find anything. The insurances, when you do work, you came to the retirement age, your health insurance is gone, and that's what we're dealing with today. It's not the young kids, it's not the homeless people that never wanted to work or the addiction. It's people that were out there working and functioning as Americans want to make a life for themselves. Down there, I've got a brother-in-law who's 80 years old. He lives on what Medicare gives. After he's gotten a certain age, he had a good retirement until he got 80 years old. He no longer qualifies for that health insurance. He's got lung problems, he's had strokes, and he's forced to move into with a girlfriend so that they could share the rent and share the cost. He's had to give up his home and everything to cover the cost of his medical bills. It's ridiculous. It's time we stand up and reclaim what was rightfully ours and put Wall Street in their place. Darlene, you're next.
I think Darlene's next.
Darlene's next. We volunteered her.
I'm Darlene Newcomb. I'm a nurse in Summers County. The thing that struck me a couple weeks ago was my mom. With all these talks about cuts to Medicare and Social Security. Came out one morning out of her house and she said to me, Dar, she calls me Dar, for Darlene. She said, Dar, I don't think I can make it without my Social Security. Well, it made me very angry. In fact, I went back in the house and shed a few tears over that. I assured her this wasn't over yet, that possibly wouldn't happen. But these are the things they're talking about doing to people. Cutting their Medicare, cutting their Social Security. The hospital that I work for, 80%, at least 80% of those people are on Medicare or they're on Medicaid. If these programs get cut, or if the health care providers, which are the hospital, get cut, what's going to happen? They're going to cut back on services, cut back on nurses, wages, whatever. Those are the things that we're really worried about and should be in this country. Thank you.
Other folks? Anything? All right.
My name is Drew Harrison, and I just want to give a medical prescription issue personally. Since I'm retired, it should be okay. An example is, I've never been allergic to bees. In June, I got stung. My supposed health care copay was supposed to be $20. The EpiPen cost $112. I had to pay half. At that point, I didn't have half, but I managed. I'm also on a couple of medications that were not paid for. One cost me $165. The other one cost $167. So at that point, I was one of those people who had to choose which one I was going to take. And that's what I had to do.
All right, thank you. Other folks?